Schizophrenia. Schizophrenia is a very complex illness. It is a term used to describe a group of severe brain disorders in which people interpret events abnormally. Schizophrenia may result in a combination of hallucinations, delusions, and disordered thinking and behaviour. Contrary to popular belief, schizophrenia is not split personality or multiple personality. Whilst the word does in its literal interpretation mean split mind, it refers to a disruption of the usual balance of emotions and thinking. It is a chronic condition that needs lifelong treatment and management. Sufferers find it difficult to tell the difference between what is real and what is not, think clearly, have normal emotional responses to stimulus, and act in a way that is considered to be normal socially. Causes. While mental health experts are not sure what causes this disorder, it appears likely that genes play a key role. Research indicates that a combination of physical, genetic, psychological, and environmental factors can make people more liable to developing the disorder. Current thinking is that some people may be particularly prone to developing schizophrenia, and a particularly stressful life event may then trigger a psychotic episode. Certain events may trigger schizophrenia in people who are at risk for it because of their genes. You are more likely to develop schizophrenia if you have a family member with this disease. Prevention. There is no known way to prevent schizophrenia. Patients can minimise the symptoms by taking their medication exactly as prescribed. Symptoms will return if patients stop taking their medication. Talk to your doctor if you're thinking about changing or stopping your medications. Make sure that you see your treatment specialist very regularly. Impacts. Schizophrenia affects men and women equally. It usually begins in the teen years or young adulthood, but it may begin later in life. It tends to begin later in women and is milder. Child-onset schizophrenia begins after the age of 5. Childhood schizophrenia is rare, and it can be difficult to differentiate between it and other developmental problems such as autism. Symptoms. Symptoms usually develop slowly over months or years. Sometimes a person with the disorder may have many symptoms, and at other times just a few. People with any type of schizophrenia may have trouble keeping friends and working. They may also have problems with anxiety, depression, and suicidal thoughts or behaviours. As the illness continues, you may have problems with thinking, emotions, and behaviour, including strange behaviours, hearing or seeing things that are actually not there, strongly held delusional beliefs, difficulty paying attention, isolation, lack of emotion, thoughts that jump randomly between different topics. Symptoms also depend on the type of schizophrenia. Paranoid schizophrenia symptoms include anxiety, anger, frequent arguing, false beliefs that people are trying to harm you or loved ones. Disorganized schizophrenia symptoms include childlike behaviour, problems thinking, problems explaining ideas clearly, showing very little emotion. Catatonic schizophrenia symptoms include grimacing or other odd expressions, rigid muscles and posture, lack of activity, not responding much to other people. Undifferentiated schizophrenia may include symptoms of more than one other type of schizophrenia. Diagnosis. There are no medical tests currently available to diagnose schizophrenia. A psychiatrist will examine the patient to make the diagnosis. The diagnosis is then made based on interviews conducted with the patient and their family members. The type of questions asked will be: how long have the symptoms been present? Has the ability to function changed? Developmental history? Genetic and family history? Brain scans and other medical tests may help rule out other medical conditions that have similar symptoms. Treatment. Since schizophrenia may not be a single condition and its cause is not yet fully known, the treatment approach is based on both clinical research and experience. These treatments are provided as they have the best chance to both reduce the symptoms and to reduce the likelihood that symptoms will return. During an episode of schizophrenia, sufferers may be needed to stay in hospital. Medication. Antipsychotic medications reduce the symptoms of schizophrenia and usually enable the patient to function a lot better than without medication. However, whilst the majority of people with schizophrenia show substantial improvement when treated with antipsychotic drugs, they do not cure schizophrenia, nor do they ensure that there will not be further psychotic episodes. Sometimes when people with schizophrenia become depressed, other symptoms can appear to worsen. The symptoms may improve with the addition of an antidepressant medication. Antipsychotics are often effective because they alter the balance of chemicals in the brain and help to control symptoms. Whilst medication can be beneficial, there are often associated side effects. These side effects can be managed. They should not stop anyone from obtaining treatment. Common side effects may include dizziness, feelings of restlessness or jitters, slowed movements, sleepiness, tremors, and weight gain. Long-term use of antipsychotic medications may increase the risk of a movement disorder called tardive dyskinesia. This condition causes repeated uncontrollable movements, especially around the mouth. If these feelings are experienced, the patient should immediately contact their care professional. Schizophrenia is a lifelong illness. Most people with this condition need to stay on antipsychotic medication for life. The treatment has two main phases: an acute phase, when doses may well be very high in order to treat symptoms, followed subsequently by a maintenance phase, which is usually lifelong. During the maintenance phase, dosage is often gradually reduced to the minimum required in order to prevent further episodes, and at the same time control symptoms. If symptoms do appear or become worse than a lower dosage, an increase will usually be necessary to help prevent severe symptoms from reappearing. Even with continued treatment, some patients experience relapses, mainly because they stop their medication. The large majority of schizophrenia patients experience substantial improvement when they use antipsychotic drugs. Some patients do not respond to medications, and a small number seem not to need them. Since it is difficult to predict which patients will fall into which groups, it is essential to have long-term follow-up so that the treatment can be adjusted and any problems addressed immediately. Support groups. Supportive therapy may be helpful for many people with schizophrenia. Social skills training can be used to improve the ability to function well in social and work environments. Job training and classes to help patients build better relationships are also beneficial. Family members of a person with schizophrenia should also be educated about the disease and offered support. Programs are available that provide support services to help people who lack family and social support. Family members and caregivers are often encouraged to help people with schizophrenia to stay on treatment. It is important that the person with schizophrenia learns how to take medications correctly, manage the side effects, notice the early signs of a relapse, react properly if symptoms return, cope with the symptoms that occur even whilst taking medication as directed, managing finances, and using public transportation. Prognosis. The outlook for someone with schizophrenia is difficult to predict. Most of the time, symptoms improve with medication. However, some people may experience trouble functioning properly on a day-to-day basis and are at risk for repeated episodes, especially during the early stages of the illness. People with schizophrenia may need special housing, training and community support. People with the most severe forms of this disorder may need to live in group homes or long-term structured residences and not by themselves. Complications. Having schizophrenia increases your risk for developing a substance problem with alcohol and/or drugs. Using alcohol and/or drugs increases the chances that symptoms will return. Physical illness. People with schizophrenia may become physically ill because of an inactive lifestyle and the side effects of medication. This illness may not be detected because of poor access to medical care and difficulties talking to healthcare providers. Suicide. People with schizophrenia should call their healthcare provider if voices are telling them to hurt themselves or others, they feel the urge to hurt themselves or others, they feel hopeless or overwhelmed, they are seeing things that aren't really there, they feel that they cannot leave the house, they feel that they are unable to care for themselves.